Integrating local herbal and traditional healing practices into modern healthcare systems represents a critical evolution in patient-centered care. Culture fundamentally shapes healing beliefs, rituals, and recovery processes across diverse populations worldwide. Understanding these cultural foundations enables healthcare professionals to provide more comprehensive and culturally sensitive care. Traditional healing systems have sustained communities for millennia, offering valuable insights for contemporary medical practice. The evolution of herbal medicine traces from ancient traditions to modern pharmacology, revealing consistent therapeutic principles across cultures. Historical documentation shows that approximately 70% of modern pharmaceuticals derive from natural plant compounds. Contemporary research validates many traditional uses while identifying active compounds and mechanisms of action. This integration bridges ancient wisdom with evidence-based medicine, creating opportunities for enhanced therapeutic outcomes. Holistic healing modalities encompass bodywork, spiritual rituals, and herbal therapies as components of whole-person healthcare approaches. These modalities address physical, emotional, mental, and spiritual dimensions of health simultaneously. Community-based healing practices recognize the interconnectedness of individual and collective well-being. Integration requires creating therapeutic environments that honor both traditional practices and clinical standards. The World Health Organization has established comprehensive frameworks for integrating traditional medicine into national health systems. These frameworks emphasize safety, efficacy, quality control, and accessibility while respecting cultural practices. Successful integration requires collaboration between traditional healers, healthcare professionals, and policymakers. Countries implementing these frameworks report improved patient satisfaction and expanded access to culturally appropriate care. Effective education strategies for teaching herbal medicine require integration into both clinical and community settings. Curriculum design must include experiential learning, cultural competency training, and evidence-based evaluation methods. Partnerships with traditional healers provide authentic learning experiences and cultural context. Community-based education ensures that integrated approaches meet local health needs and cultural preferences. Decolonizing healthcare systems requires recognizing and validating indigenous healing within dominant medical paradigms. This process involves addressing historical marginalization and creating equitable partnerships. Successful decolonization creates space for multiple ways of knowing and healing within healthcare institutions. Examples of local herbal and traditional healing practices span every continent, from Chinese acupuncture and Ayurvedic medicine to African traditional healing and South American plant medicines. These diverse practices offer evidence-based approaches to pain management, mental health, chronic disease, and preventive care. Integration of traditional healing practices enhances healthcare delivery, improves patient outcomes, and honors cultural diversity. For healthcare professionals, embracing these integrative approaches represents a commitment to comprehensive, culturally responsive, and patient-centered care.